A very good morning to Miss Wai and my fellow classmates. Today, me and my group mate Shamin and Lishan will present about the introduction and literature review.
Starting from the background study, there are a total of two main types of sleep. Firstly, non-rapid eye movement sleep, and secondly, rapid eye movement sleep. Non-rapid eye movement sleep, also known as quiet sleep, while rapid eye movement sleep is known as active sleep or paradoxical sleep. Sleep is divided into four stages. Firstly, non-rapid eye movement sleep stage 1. During this stage is the beginning of the sleep cycle and is the transition period between wakefulness and sleep. This period normally lasts around 5 to 10 minutes, and studies have shown that if you are awakened by someone during this stage, they might report that you were not really asleep. Next, in the non-rapid eye movement sleep stage 2, your body temperature and your heart rate will start to decrease and go down. According to the American Sleep Foundation, people tend to spend approximately 50% of their sleep in this stage. And this stage normally lasts for 20 minutes. And in this stage, you will also become less aware to the surrounding. Moving forward to the third stage of non-rapid eye movement sleep is referred as delta sleep. People will become less responsive in this stage as is the transitional period between light sleep into a very deep sleep. Sleepwalking and bedwetting are also more likely to occur in this stage. During this stage, humans' muscle will relax, blood pressure and breathing rate will drop. The deeper sleep will also occur in this stage. Lastly, in the rapid eye movement sleep stage 4, most dreamings occur in this final stage. It will increase the respiration rate and brain activity of an individual. Humans will spend approximately 20% of their sleep in this stage, as the brain becomes more active and the body becomes more relaxed and immobilized. It is important for us to know that sleep does not go through these stages in sequence. It begins with stage 1, continue on to stage 2 and 3. However, after stage 3, stage 2 is repeated before entering the rapid eye movement sleep, which we consider it as stage 4.
The introduction part. The background of the study. Sleep plays an important role and is an inseparable part of human life and health. It is the main factor that could affect one's mental and physical health. Therefore, sufficient sleep helps to ease learning and memory processing. Studies show that inadequate amount of sleep, sleeping in a short time, and staying up late cause major impact onto one's mental and physical condition, especially on university students, as it will affect their academic performance. Young and old adults should always have an average and balanced sleeping hours, which is 7 to 9 hours every day. However, the frequency of young adults sleeping lesser than the average duration has been higher. With poor quality of sleep, it leads to excessive daytime sleepiness (EPS), which is defined as unmanageable sudden compulsion to doze off during daytime. This then further studies in the inability to concentrate and stay alert on daily tasks and studies that has impact on academic performance.
Most importantly, disturbed and insufficient amount of sleep could lead to many serious problems such as, firstly, judgment impairment. It leads to irrational action and risk-taking behavior. Judgment impairment is a medical condition which causes an individual to be unable to process information and make good decisions due to the medical issue. Next, agitation is a state of anxiety that has symptoms such as irritability, oppositional behavior, and inappropriate language. Irritability is a feeling of agitation. Individuals who are suffering from the symptoms of irritability are more likely to feel frustrated and upset in their daily life. Fourthly, inability to process information, as everyone could see, is that individuals have no ability to process the right information. Cardiometabolic disorder, also known as cardiometabolic syndromes, is a combination of metabolic dysfunction such as insulin resistance, impaired glucose tolerance, hypertension, and central adiposity. Lastly, disturbed and insufficient amount of sleep could also lead to increased mortality of an individual. Furthermore, we have studies showing that psychological stress also leads to students to have poor sleeping quality. 1/4 out of 507 students has suffered from psychological distress, which causes them to be suffering from poor sleeping quality based on previous study. There are also studies showing that high caffeine intake due to heavy academic workload causes them to have higher chance in facing sleeping disorder and insomnia.
Studies have reported that the frequency of students experiencing poor quality of sleep and has reliable how its impacts on the academic performance of university students, showing that it is necessary for the student to change and improve their sleep quality, which will subsequently enhance their academic performance in universities. The research aims to check for relevance and focus on the effect of sleep quality on university students' academic performance. Through the significance of study, first, the study aims to assess the student's ability to perform academically in relation to his or her quality of sleep. It is crucial for students to pay heed and make changes on their quality of sleep as it would affect on their academic performance. Next, this study also aims to understand more on whether do gender difference affect sleeping quality of students, which will further act on the academic performance in university, leading to obtain more understandings on how do sleeping quality impact on students' academic performance, which instruments that they are being used to tackle the issue and how it is subject being addressed and studied.
Therefore, our research question would be, first, what is the relationship between sleeping quality and university students' academic performance? And second, what are the impacts of sleeping quality on university students' academic performance? There are a total of 4 subtopics in our literature review. Firstly, psychological distress causes poor sleeping quality. Psychological distress has been recognized universally and has effect on many individuals' productivity and daily life. According to previous research, psychological distress and anxiety symptoms among students were the significant predictor of poor quality of sleep. The result revealed that half of 505 students are having poor quality of sleep and 1/4 of them are suffering from psychological distress. Moreover, they also found out that the symptoms of depression and anxiety had significant association with poor sleeping quality of students. Besides, there is another study which was conducted and has found out that perceived stress level has significant association with poor sleeping quality. Findings obtained a statistically significant association between stress and poor sleeping quality of students, which also indicate that there is a high prevalence of stress and poor quality of sleep among university students. It is also revealed that students without stress issue are less likely to suffer from poor sleeping quality. In conclusion, both studies above have shown an immediate interrelation of psychological distress and student sleeping quality. Therefore, it has proven that psychological distress has caused impact on university students' quality of sleep.
Literature review 4. High doses of caffeine causes poor sleep quality. Most university students face poor sleep quality due to the huge amount of workload, as there are lots of assignments and tasks that need to be completed in the period. Hence, they need to drink coffee and tea to stay awake, which results in the occurrence of high doses of caffeine. In fact, this previous study by Haider Osman Mekhani has proven that high doses of caffeine had negative impact on university students' sleep quality. The purpose of this study is to acknowledge the effects of high doses of caffeine on university students' sleep quality. The researchers plan to prepare the score to measure the level of sleep quality and its sources among university students by using a survey questionnaire. A total of 140 medical students, which were 65 students in excellent group and 75 students in average group, from University of Omdurman and University of Bari, were included in this research. The survey results show that due to the high doses of caffeine increase, the students' sleep quality declines. The reason is that poor sleep quality may limit students for engaging in useful educational activities. In consequence, high doses of caffeine may lead to poor sleep quality. Besides, Another study by Sixto E. Census found that excessive caffeine intakes play a pivotal role in weakening university students' sleep quality. The purpose of this study is to assess sleep quality that related to lifestyle characteristics, including consumption of caffeinated beverage by Peruvian university students. There's a total of 2,458 college students, which were 965 males and 143 female students were invited to complete a self-administered questionnaire. The Pittsburgh Sleep Quality Index (PSQI) was used to measure sleep quality. A logistic regression method was used to evaluate the odds ratio and 95% of confidence interval of poor sleep quality that related to lifestyle characteristics such as high doses of caffeine intake. Therefore, the researchers found that high doses of caffeine and sleep quality have shown a negative relationship. This is because university students might have been influenced by peers to be participated in unusual and harmful activities during midnight. This may lead to negative sleep quality changes such as caffeine intake after 2 p.m. and thus it leads to a decline in sleep quality. To conclude, both studies have shown that high doses of caffeine is directly affected towards university students' sleep quality. The first study by Haider Osman Mekhani have proven that high doses of caffeine limits university students for engaging in useful educational activities. The second study by Sixto E. Census have shown that students who participate in unhealthy activities due to influence by peers have poor sleep quality among university students.
The third topic is about poor sleep quality causes low academic performance. Few studies have shown the relationship between sleep, stress, and students' academic performance. In previous studies, they found that the influence of sleep on academic performance changed. The main purpose of this study is to determine whether sleep and stress will affect students' academic performance. The results show that poor sleep quality is very common in medical students' life, which will lead to the deterioration of their academic performance. The link between poor sleep quality and low academic performance provides a strong evidence. Then, another study found that sleep quality plays an important role in dental students' academic performance. The purpose of this study is to explore the relationship between poor sleep quality and academic performance. The results show that poor sleep quality or lack of sleep will reduce attention or damage memory, resulting in poor academic performance. Therefore, there is a stronger negative correlation between sleep quality and academic achievement.
The last literature review. Social media usage causes poor sleep quality. Social media has been playing an important role in our life this day, especially on students and young adults. Based on previous studies by Garrett, social media use has a high interconnection to students' sleeping quality. This study's purpose is to determine the relationship between sleep quality and social media use among undergraduate students in college. There was a total of 181 students from University of California, Los Angeles, UCLA responded in the survey. All participated students have to be active social media users. They were required to complete an online survey once each week, will last for 10 weeks. This study then further obtained a result where students who use social media more frequently on late nights during weekends are more prone to suffer from poor sleeping quality, while those who use during weekdays evening are less likely to face sleep problems and are having better sleep quality. Thus, it can be concluded that social media use is associated to sleeping quality among students.
Another research has also come upon that participants with higher frequency of social media usage has greater odds in having sleep disturbance. This research attempted to evaluate the sleep quality among medical students and investigate the relationship between social media use and sleeping quality. The findings revelate that 66% of the students are suffering from poor sleeping quality. Besides, results also show that they are approximately 92% of the two-part students use electronic device before they go to sleep, and 88% of them are using it for social media purpose. Hence, summarizing that students that spend time use social media before going to sleep are reported to have poor sleeping quality. In conclusion, social media is negatively associated with student sleep quality. Previous studies focus on specific sources of sleep quality while studying the impacts of sleep quality on academic performance among university students. In the past, the number of researchers was limited. They used various sources of poor sleeping quality factors to investigate the relationship between sleep quality and academic performance among university students. Poor sleep quality is caused by multiple factors and could lead to declination to academic performance of students. The current study wants to measure the correlation and the impact of poor sleep quality on university students' academic performance by estimating the four sources of poor sleep quality to verify the reliability of the findings. That's all for our presentation. Thank you.